Hi guys.
Hello.
Hello, Nicholas.
How are you doing?
Good, good.
Very good. And you?
Good.
Good, yeah, not bad, thank you. So look, thank you for joining me on my sofa for what is going to be a little chit chat as about the public versus private healthcare system in Portugal, but we're going to be focusing on the Algarve because obviously that's where we are. So just for our viewers, I suppose we just thought from one of our last webinars, there was a bit of information requested, a bit of a constant, what's the word, topic that kept on coming up that people wanted to hear a bit more about the public and private health system in Portugal. So we thought let's have a little debate / chat amongst us, which is essentially the Algarve Addicts team. Our guru is sat on the beach somewhere, sunning himself. We couldn't persuade him to log in from here, but yeah. So apologies that you got to put up with me talking for a little bit, but this will be all of us chatting and inputting to this, which is an informal discussion. I will in a moment just get everyone to whip round and talk about themselves. But look, I've been here in Portugal for 15 years, I think this year. And I've come from London, UK, in terms of obviously the NHS and private health systems there. Obviously, been very lucky that I haven't had to have any major surgeries since I was a kid. So I'm definitely not going to be comparing and contrasting here. But yeah, I think from my let's see what happens when it gets to my opinion. But yeah, it's going to be an interesting topic. So Lilia, can I call on you first to just introduce yourself and about you and how you're involved in the Algarve and everything else?
Yes. Hi. I'm Lilia. I'm a freelance admin, and I was kind of the first person to start working with Algarve Addicts. So I work majorly with Nick Robinson and sometimes with Nick Smith. Yes. I lived in Algarve my whole life, and then I lived in London for 8 years. So I have both experiences, public, private here in Portugal, and also in the UK. So I think I have a lot of experience on that area.
Okay, ladies first, Claire.
Hello, hello. I am Claire, and my most recent healthcare experience was this morning, actually. So nice and fresh in the mind. I've also had a bit of a mix of experiences in the public health sector and the private health sector. I'm sure we'll get into the specific experiences later. But yeah, I think it's an interesting topic. It's one that is polarizing, I guess. And as we all know, health systems, or at least public health systems all around the world, are super overburdened, and it's something that we have to think about, especially if you are moving to the Algarve as a retiree. It's something that should be on your list of things to think about. If you have a family, I am currently 25 weeks pregnant, so it is a very hot topic for me right now. So yeah, really excited to join this discussion.
Thank you. Duarte?
Duarte from Faro, born and raised here. I have plenty of experience, whether it's the public or the private. My mom would say so, between broken arms, broken legs, surgeries, and many things. Also, recently had the pleasure of having 2 surgeries in one. So I got the deal 2 for 1. So hopefully I'll be bringing some input of what it's like, of the reality of healthcare in Portugal.
I'm pretty sure that you spend most of your time with your kids in the healthcare system.
Yes, yeah. My son, basically, they already know him by his first name in public hospital in Faro. So yeah, we also have that.
Okay, well, look, let's just kick off with just a couple of quick questions, just to set the tone here. So I'm just going to pick on. Well, I think Claire, you kind of gave it away earlier, so I'm going to come to Lilia first. With public or private, which one was your last appointment? Where did you go for your last health or family related thing or whatever?
The last one, it was private.
Okay.
Yeah, to do exams because it's quicker than the public. Really.
What?
Private. To be honest, just because of a time frame. If I had to go through public, I would have to wait a couple of months. through private was a matter of a couple of weeks.
Okay. What about you, Claire?
This morning, I had some second trimester blood tests done. That was through the public system. And last week, I had an appointment in the private system with an OBGYN. So, little bit of both at the
Okay.
moment.
Just for uniformity, private was mine. I think I had the sniffles and needed to, go and get some man up pills from that was me. What about going kind of reversing? Dwight, what's the longest you ever waited for a consultation?
The
Another public
longest
or private?
it was probably with my kids. Usually, what do we have? We have something called the healthcare center, Centro de Saúde, which is of course public. And then you can register yourself and your family. Ideally, your entire family has one family doctor, one family nurse. Okay, mine is Dr. Antonio and Enfermeira Sinara, and because of the amount of people that you have per area, in my case, because my city is Faro, I'm registered in Faro, so we go to Osonuba. And for my son to have an appointment, once we had to wait almost 2 months. It was about a month and 4 weeks. Luckily, it was a routine appointment. It was nothing urgent. But I've seen many people waiting 2-3 weeks, a month, to get the normal appointment. Especially if it's something more specific like a heart doctor, skin doctor. If you get referrals, it's when you have to wait a lot in the public system. To the private, of course, because it's paying, you usually get an appointment within a week or less, at least from my experience.
Then let's just recap on that one. A Centro Saúde is what?
A Centro de Saúde it's called a healthcare center, which is for anyone that lives in Portugal. You can register your family through the public system. And why is it handy to be in the public system and have a family doctor? Imagine recently when I had my surgery, if I could not work for a long period of time, is actually your family doctor that issues you a document that says that you cannot work, and then of course you can use that if you're, as my example, if I was for a long period of time, which is not the case, but let's say if I had to be 2 months without working, I am entitled to a certain amount of money, depending on my deduction, and the government pays you that amount of money. We call it a baixa. So that document needs to be it needs to be updated or be given by your family doctor or by the doctor that actually did the surgery to you. Okay. For any documentation, especially for the children, it's really good once if your kid is born here, or if he's being, if you want to, especially at the age between, birth and 5 years old. Here in Portugal, we have routine appointments, and we have vaccines that we have to give, and we size the kids, we weight the kids, we make sure that they're growing well, the vision is good, the hearing is good, everything, and that is done by the family and the nurse doctor. Okay. And those appointments, at least for me, from what I can understood, they were mandatory, and the same with the vaccines, they were mandatory, and you can do that all by the public system. It costs you absolutely zero, and it works very well, but you need to plan ahead, just because there's a lot of kids in the system. There's a lot of elderly people also that they want to have appointments there, because they come and check on several problems that they have. And it's your family doctor that sees you. You don't see any other doctor than that doctor.
So remind me, you get a health number.
That's correct. Yes. So each one of us has a health number, and then depending on the parish that you're living, where you are registered, you get appointed a healthcare center. Okay. In my case, is Osonuba. It's called Osonuba, which was the first name of Faro. It was Osonuba.
There you go. Lilia, this was supposed to be a quick fire question round, but all the stuff there was fabulous. So thank you. Lilia, what about you? What's your longest that you waited for a consultation?
Actually, I'm still waiting. I was referred from my GP, which is the family doctor, to be to an appointment in a public hospital for gynecologist, and it's been like 3 years now. So I'm still waiting. Yep. because I have endometriosis, and the doctor decided to refer me there. Obviously, I have my private gynecologist, so but still waiting.
Wow, 3 years.
Yeah.
Well, just on that, 3 years, is that, and there is no way you think you could be at the door, banging the door louder, the drum louder. It's just
on that appointment 3 years ago, I was referred to a gynecologist and urology, and then I had, meanwhile, 6 months after that, I got the appointment with a urologist, and then I had surgery, and I'm still waiting for gynecologists. They don't have professionals down in the Algarve, so yeah.
Wow. What about you, Claire? I mean, I know this should be interesting. How was your longest consultation?
I am still waiting for my postpartum 6-week follow-up from the birth of my first son. He turned 3 last month. So he's just turned 3, and I never got my 6-week postpartum follow-up. I'm still waiting.
Right.
Yeah, but I think on to Lilia's point, OBGYNs, maternity, gynecology is unfortunately just one of the sectors in the public healthcare system that is particularly strained across the country, but more so in the Algarve. It's a huge problem, the shortage of doctors. So that was a lot.
Did you have the birth down here or up north?
I had the birth up north, so that's.
Oh, it's a rubbish up north. So it's fine.
No, he was born in Matosinhos, in Porto, and it was through the public health system. But yeah, I think that's one of the reasons that.
Okay.
By the way, there's another one that I remember now. When I had surgery to one of my kidneys, they left kind of a tube inside, and they said, this is kind of a drainage for your kidney, and then we will remove it 6 months after. It's been 3 years, and I'm still waiting for them to call to remove the tube. But I removed it. I went to a private doctor because
I was going to say, what did you just cut yourself open?
No, it's very easy to remove. But I went to the private doctor, and he removed the tube. So now I have the tube in my car, like waiting for the public hospital to, send me a letter or a call. Oh, can you come here so we remove your tube? And then I'm going to take the tube. And there you go. There's your tube.
So, I mean, what everyone's saying, right? It sounds pretty crazy. Like, is it a case of, do we think it's a case of completely, we're talking about different departments here, but like, do we think it's a case of underserviced, undermanned, or we talk about the systems just a little bit?
I think it's
not great, and therefore somehow these appointments fall through the gaps, and you as the patients are the ones who be driving the reminders.
I think it's
a lack. Yeah, I think personally it's a lack of organization and the amount of people that the system has. The system can't bear with the amount of people currently that we have. And that proof I can give you. My mom is my best friend whenever I have anything. And I'm going to tell you why. It's very simple. I say to my mom, Mom, I have this situation. And my mom knows which doctor, more or less, of course, because she, mom being a mom. And, she always tries to see, okay, where is this guy today? Is he in the public or is he in the private? And she tries to get me an appointment to him as soon as possible. And another thing that she does that truly works, and I've seen this throughout the years, is she's persistent. So she doesn't just book for an appointment. She books for an appointment and she keeps doing daily follow-ups and until she gets an answer, and it does work. It shouldn't be like that. I'm not saying that's the right way to do it. It's not, but it does work. And the best example is exactly that. Like she managed to get me an appointment with my surgeon that did my surgery. If I have, what was it? January, I think, the next year, to get an appointment with him to see what my issue was to get into the surgery, to eventually be, ideally, when I met him in the private, he said to me, I can give you the surgery in the public in March, or I can do the surgery in 2 weeks. And I said, I'll just do it in the private in 2 weeks. Luckily, insurances here are affordable, and the surgery, didn't cost me a leg and an arm, so I did it.
What what you're kind of saying there to me is a bit of a spoiler alert for Portugal, or certainly for the Algarve, is when it comes to bureaucracy, and I'm going to class this in bureaucracy, you need to be belligerent, you need to chase, you need to be persistent. I'm not saying it's not a good reflection, but it's sadly it was one of those things that you learn to not laugh, but just accept that you're going to have to do a lot of chasing, a lot of following up, and a lot of things to get the things that you need to, and done, in that sense.
Yeah.
So, has anyone had a surprisingly good public health experience? Oh, go on, Claire.
Yes, absolutely. So many. And I think it comes down to the people. The level of care that I have received in the public system has been hit and miss. But when it's good, it's because of the compassion and the care and the quality of the people. I had a very difficult birth in the public system, and I had 2 or 3 nurses afterwards that were absolutely phenomenal in their support, their care, everything. Then our Centro de Saúde, our healthcare center up in Porto, I had our nurse come and do home visits, which was like, she didn't have to do that. It was just unbelievable, and she was so sweet, and didn't speak a word of English, but she was unbelievable. And then this morning, I went to do some blood tests, and I had my glucose fasting test, and I had to be there for 3 hours. And the ladies took me from the waiting room, and they put me in an unused consultation room, and I was sat at a desk with an office chair with my laptop doing some property searches for some clients while I waited, and they were just so kind. And there we go. So I've had a mixed bag. I've had awful experiences, but I've had incredible experiences, and I think the incredible experiences have come down to the people that I've encountered in the system. And also I feel very privileged to have access to that system, because I don't take for granted that I'm not Portuguese and I wasn't born here. And although I'm still young and I pay taxes and I pay social security, I haven't contributed to a system for an entire lifetime. So I don't take for granted that I have access to the system that arguably, legally I'm entitled to, but ethically and morally, maybe I shouldn't be, and maybe. So I respect that, and I don't take that for granted, and I definitely would recommend anyone who has the means to 100% go private, because of so many reasons. But I have had some really great experiences in the public, and the doctors incredible. So yeah, so lots of singing of praises as well. Yeah.
Yeah, I agree with you. Yes, I had an amazing situation with the Faro hospital when my grandma was there. She had a stroke while she was being treated for something simple, some infection. And during her stay, she had this stroke, and they called me straight away. So I went to the hospital, and it was visit time. So I went up to see her, and she wasn't there because she was taken to do some tests and scans, whatever. So and I tried to speak with the doctor, and the doctor said, "Oh, you need to wait because she's downstairs doing the exams." And I said, "Oh, I don't have much time. I just came here because I'm working, but you called me about the stroke, and I came quickly." So this doctor, he left everything he was doing, and he took me down to the CT scan room, and he made them stop everything so I could speak with my grandma. And it was great because it was the last time she was able to recognize someone. And and then she passed away. But the care we received from the doctors, it was absolutely amazing. Yeah.
Okay. So, I mean, they're kind of moving on to a different section. What defines good healthcare? I'm going to stop doing rabbit ears if I can remember. What defines good healthcare? And I think, you just touched on one massively. Well, both of you have, Claire, and then, which is about the people.
Yeah.
The people. I mean, obviously that can happen in both systems, but generally, if we're looking at healthcare as a general sort of topic, would you say that the personalities and personal attention is the biggest the biggest sort of brownie point in giving, for good healthcare, or is there anything else that you would include in that definition of good healthcare?
I have come across so many incredible professionals who have been so kind and so lovely, but I think it's very hard to stay kind and lovely when the circumstances you're working under are really difficult. So if if they're short-staffed or they don't have the facilities or the equipment, or they're underpaid or anything like that, and that's why I think it's hit and miss. I think it's incredibly difficult to stay with your heart in it if the conditions under which you're working are very taxing. So
I mean, I agree with that. I mean, certainly when it's, I mean, my as I said at the outset, my experience of healthcare is around the UK and here, and you can say exactly the same in the UK. It's understaffed, or the amount of the money, and it comes down to the people. You have to go back to the COVID experience and seeing, how much everyone, they used to have the applause every day for, the healthcare work with professionals who are battling through that time. So it 100% comes down to, that obviously is a major factor. Anything else? Quality of surgeons, machinery.
For me, to be honest, I'm probably a very different opinion of most of people. I don't care if my doctor is nice. I don't care if he wants to talk to me or not. I just want him to get right on the first time. Whenever he assesses me and whatever he thinks I am, it has to be right. And to be honest, at least from my experience, I've never had an issue that I've had to go to another doctor or get a different opinion or anything like that, because they've always been quite good. I've been starting only to get second opinions now that I have my kids, and 99% of the time, the opinion of the other doctor is exactly the same as the previous doctor that we've been. So it makes me believe that the doctors here are well trained. They're well, they perform well. Yes, it's nice to have the human part, without any doubt. Of course, I want to be, well taken care of. I want to have a doctor that is also, passionate for what he does. I have the perfect example. This doctor that recently did my surgery, he clearly is a fantastic surgeon, without any doubt, but he's also passionate for what he does. And I noticed that when he did the rounds to check on, on his patients, because the rooms were all next to each other, what I was saying, and he was actually chatting with all of us, not just asking how we were, but he was genuinely curious to, to know little things about us. And I thought, of course, that makes a huge difference. But for me, the most important thing is if the guy finds, something in me, he knows how to take it out or to fix it, or, and have a quick and painless, hopefully, experience and be as quick as possible,
Mm.
Well, I think, I mean, just to add to that, I think, from my perspective, I've always, I've always had this inherent trust with doctors that you think, hang on, I'm going to hospital, therefore they must be able to solve the problem, save my life, whatever it is you need to do, which, can be sometimes misguided, of course, you can't always, but, how do you know what's right and wrong when when you're lucky and fortunate enough not to be in hospital kind of all the time and seeing the way things operate and everything else, so, I think for me, yeah, good healthcare is that trust moment where someone can make you feel at probably your most vulnerable moment. And it doesn't matter what you're doing. You're not at home. You potentially, especially like during the COVID time, you work with your loved ones. They can't always, visit. They can't always be there. And taking that leap of faith and trust and putting it into other people's hands, which then comes down to this perennial debate over public over private. So, Lilia, what do you think are the biggest misconceptions about the public and private systems? Have you got any ideas and thoughts on that one?
Yeah, I think people think that the private it's the best care, but it doesn't work like that. Most of the doctors and the nurses that work in private, they always work in the public as well, so they work in both places. And also, for instance, if you have a life-threatening condition, like you having, I don't know, heart attack or stroke, you should always go to the public, because especially in the Algarve, private hospitals, they don't have the resources to help you on those with those type of issues. So I think sometimes I have friends that if they have any problem, they go to the private, and then they have to be sent to the public. So what's the point? Just go to the public. It depends on what's the issue, the severity of the case. That's what I think. People always think private is best, but it's not.
Yeah. Well, I mean, interestingly enough, and sorry to the audience, there's quite a lot of, I suppose, childcare stuff, 'cause, in here, but, there's sort of some of my recent experiences there. But like they said to us, look, when my wife was having a C-section in the Gambellage, they were saying, hey, look, if something goes wrong or there's a problem with the baby or whatever, with the pediatric units in Faro, we will have to take you there.
Yeah.
So, there's a level of, from what I can see, private healthcare gets you through the front door a little bit quicker, or a lot quicker. Obviously, you're paying for the privilege, or your insurance is, depending on whichever plan you have. But yeah, as you say, like, if there's a big issue, then you're probably going to be transferred. I mean, having said that, though, I had my father-in-law had some heart valve replacements. And the guy came down, I mean, it was private, okay? But the guy came down from Lisbon for a couple of weeks. He bought his whole team and all his equipment in a van, a lorry, and then parked up in Gambellage for 2 weeks and just churned out these surgeries. And my father-in-law was the first one that he did, as a remote surgeon. So there you go again, remote surgeon. So for non super urgent stuff, they have creative ways of doing things.
Yeah.
So I suppose, Claire, what do you think drives someone to choose one, public or private, over the other?
I think having insurance as a requirement for visas and things like that obviously makes it a lot easier. Like, you don't have a choice. You've got to have it. But I think, just to echo exactly what you've just said, you get in the front door so much quicker. Sorry to bring it back to the childcare again, but I was unable to get a first trimester pregnancy scan at all in any public hospital anywhere in the Algarve. I eventually got a first trimester scan. I had to drive an hour and 20 minutes to the West Algarve. I'm based in the East, to get a scan, because there are just no appointments available. Even in the private sector, it is severely strained. So I haven't had the opportunity to go public during my pregnancy because there just isn't capacity. There are also a lot of gynecological ER closures. So generally, one hospital will be closed and the other one won't. So if a pregnant woman goes into labor, they've got to check online or phone a number first to see what's open, and then you may have to drive to Portugal or to Faro, vice versa. And there's been a couple of stories in the news recently of women giving birth in ambulances or on the side of the road and not making it to hospitals or things like that. So I think having the option and that access to the private sector is incredibly reassuring. But I absolutely agree with what Lilia says. If it's a life-threatening situation and you are going to need, if you're going to be triaged a green armband somewhere, you're going to wait in the public system for hours on end, and in the private system probably the same. But if you are truly in a life-threatening situation, the public system is where they're going to end up taking you anyway.
Well, I mean, interestingly enough, I've got a friend who needs a hip replacement, and his options are wait 8 to 10 months to have it, via the public, or pay the best part of 12 grand and do it via the private.
Yeah.
That comes down to, I suppose, a decision making around pain. Do you sort of get hooked on opioids to get yourself through the 8 months, the 10 months, or deal with the pain with no medication, or try and find 12 grand to go down that line and get it done, privately. But sometimes
that's because he doesn't have a health insurance.
Yeah, true. Yeah. But it's just, kind of frame the whole environment,
And I think also it's that access, if it's not something particularly life-threatening, it also is a more curated experience. Whereas the public system it's necessity. It's not about aesthetics and a beautiful building and a hotel-looking room. Whereas the private system, you get that slightly polished experience where things are just a little bit more polished. And, the public system, things are not falling apart, but it's strained, it's underfunded, and it's,
Well, look, I mean, here's a stat for you, right? That combined private, so full private, and I don't even know how you do part private, but services that are dealt with by the private accounts for over 50% of Portuguese of people in Portugal. Of the 10.75 million population, 50% have some form of private health.
you have to.
Mad. Like and when I was looking that up just now, I was like, I swear to God, this is true. I mean, it's an enormous amount. So the strain, kind of is almost equal, really. In that sense of what's around. It's why it's such a burgeoning sector. I know I have come across a couple of major funds who are pumping a lot of money into building private, hospitals and stuff, and in the Algarve alone, let alone, and we have our own. And certainly historically, we have our own, not issues, but our own type of person here. That a lot of the Brits came to retire here, and therefore that brings in a different age profile of problems. End of life kind of problems, care, age, dementia, cancers, whatever it may be. There's so it's an interesting. It's certainly an interesting place. I think from, let's just say, a general positive, I choose private to do private, and that's just not to say I take on board what everyone said. I wouldn't not go to the public. I would if it was, I might not have a choice if I had a heart attack. I would just take it there by, a family member, friend, or an ambulance, whatever. But I kind of have this overriding desire to not be a burden on the system. If I can afford to, and I can pay private health to keep myself out of those places for people that don't, then I will. And lucky enough to be able to the point when I have Captain Nibble down and I go to the private hospital in Lule. I go and have. I swear, as I call that, because I to be honest with you, I think I've only ever been to the Centro de Saúde for my kids' injections. I will go and pay $20 or $50 or whatever it is, depending on the card. We can get these cards if you haven't got full insurance, to reduce your wait time, and you just go in and you go into the emergency. You're not an emergency, but you get seen, you get dealt with, and then kind of away you go. That being said, I've had some fun, some very, Mar shopping, the big shopping center. There's a sort of clinic there. I think it's an HPA clinic.
Yeah.
And you can go in and book it for certain things. Where they've done miracle stuff in that place is that you can go and they run a campaign twice a year, I think it is, that you can go and get a free blood test for early signs of prostate cancer. And I just think it's one of the best things I've ever seen, because you just turn up. I walked in there to book an appointment. They're like, no, sit down. Go in there, and and kind of away you go. I think, oh no, Doc's not having that. And yeah, they took the blood and they gave me the result the next day and said, there's no elevated markers. And what a great combination of using a massive shopping center, a great advertising campaign, and a private health clinic. And again, it was free. So, equally, let's not beat around the bush and to chuck this out there. Obviously, Lília and Duarte are fluent Portuguese speakers. Claire is much better than me. But I've had some interesting run-ins with doctors. One who just couldn't, between every appointment, she had to run out and have a cigarette and then come back in. And so it wasn't like the best experience. And I remember trying to communicate whatever it was. I can't remember what it was. Oh no, I had this, you get it from the beach. I saw it here. This could be complete rubbish, but it's like a fungus in your skin. Like it's just like white blemishes.
Yeah.
And it comes in patches, and it happens in like humid countries, and apparently it happens a lot from the beach. Or if you're wearing gym kit quite a lot and you leave it on, like post a tennis match or something. And I had this stuff, and I was trying to explain to this woman what it was and showing her what it was. And I took the prescription into the pharmacy, which is literally opposite. And the girl in there went, "Oh, okay." I was like, "What does that mean?" She's like, "Well, can I just ask what the condition is?" And I said, "Oh, it's this." She was like, "Yeah, that's not what she's prescribing." So I can't even remember what it was. She said, but she said, "Do you want me to come back in? Do you want to come into the meeting with her?" I was like, "Yeah, that'd be very kind of you." So the lady from the pharmacy, obviously this is kind of healthcare related, but not walked me back in and said, "This is what it is." And she's like, "Oh, okay," and then just redid the whole thing. So she's one I avoid. Let's put it that way. But generally speaking, I've had pretty good experiences on that front. So where are we? Big picture, personal stories. We've shared quite a lot of personal stories. Is there any other highlights or lowlights that you kind of want to share in your time, here, or do you think you covered it off by now?
Well, I have one with the public system. With my kids, I always use it because I have no bad stories. My son literally broke his head already 3 times.
Oh my God.
And every time we run the middle of the afternoon, the morning, the whatever time it is, we get there, he gets seen straight away by a nurse, and they stitch him up and they give him a little candy and they talk to him and they try to distract him, and he's not traumatized. He genuinely, and unfortunately, he had to go twice with an ambulance to the public hospital, and he loves to go on the ambulance. So
Doing it on
for me,
purpose, not
that's
Sandy.
yeah, and he was very well taken care of. Me as a parent was, I was also, nurses were very attentive. The doctors that helped my son also were very attentive. So I always go to the public. I don't even think of going to the private. I go to the private with my kids just to see my pediatrician. Other than that, but it's just for if they get a cold or something like that. As you said, I don't want to bear also the public system because I know, first of all, I know it's going to take a long time. But then at the same time, because I have an insurance, let's just use it. Because an appointment with my son cost me 20 euro. I prefer to pay the 20 euro, get it done, not part of the public system. And I see my pediatrician, the one that I want. Is it fair? Not really. I should not have to have a public, a private insurance. I should just be able to use the public system, and the public system should work. But unfortunately, as is, I prefer not to use it sometimes.
No, look, just a little caveat there. Duarte is a fabulous father, and social services. If you're watching it, you don't need to interject. I can vouch for him. It's just his kids are inherited his accident proneness.
Yeah.
So like,
it's just the one. It's just the one. My daughter is actually calm to some extent, but it's mostly my son that is a very active child, and he puts himself in many situations. Although I try to control him, there's so much I can do.
We'd challenge you on that one, but we won't. That's the word. But Lilia, what about you? Any other personal stories? Any other sort of wow moments, frustrations? Most people say time is the biggest frustration in terms of either kind of waiting. Well, this kind of does kind of move in. Waiting times are probably one of the biggest ones.
This is a big, long story, but I'm gonna try and fast forward. So when I had surgery on my kidney, it was COVID time. Kind of end of COVID, but still a lot of restrictions at the hospital. So I was admitted. I was prepared for surgery. And just before my surgery, I got a text from a friend saying, hope everything goes well with you. We were together Sunday, just to let you know that I'm positive for COVID. And I'm like, oh my God. So I had to inform the nurses and the doctors. And because of me, they closed the whole wards. They moved me to a private room. And I was like very excited. Oh my God, I'm going to have a private room. So they moved me there before surgery. And then they were like thinking, maybe we're not going to do the surgery because we don't know if she's positive or negative. So they did the tests. They came negative. And then the doctor said, I'm not going to do the surgery. But then the surgery director, he said, you're going to perform the surgery because the risk of her having COVID, it's so low and she needs the surgery. So I did the surgery. They had to close the whole ward for me to pass. And then they had to use a different lift to go down to the theater. And then in there, they had to use a special room just for me. And then when I went up after surgery, I spent like 4 hours alone. The doctors wouldn't come because they had to use all of those protections. And I was in pain. I was ringing the bell. Nobody would come. And I was there for 4 days. 3 of those days, there was a strike. So there was nobody at the hospital to see me because I had COVID. I would get like the meals on like this paper plates. Everything would
Slid under the door
terrible.
like a criminal.
And then like day after the surgery, I would call the nurse because I was in pain. She opened the door and from the distance she would throw the medicines at me like, just take it. And I'm like, I don't have water. So it was terrible. But it was COVID. They had no staff. There was a strike. I didn't die because it wasn't my time.
No. Well, that's good to hear. And obviously, you're with us. So congratulations on pulling through. But yeah, I mean, that sounds pretty.
No, it was
pretty
horrible.
But yeah, but sadly, at COVID-defying time. Well, look, I mean,
Well, let me say one quick story about COVID and about how Portugal is. So technically, when my son was born, I was not supposed to be in the birth room, but because we're Portuguese and we love to chat and we love to promise many things, I've managed to talk the guy down to let me go up, and I've managed to convince the doctor to let me be in the birth room with Shona. So this is Portugal. There are rules, but there's always ways. We call it jogo de cintura, which means
I think they're scared of your mother. The one that treats the doctors.
She knows everyone. Well, look, I mean, if we really don't mind, and obviously, if you don't feel comfortable talking about money, then please don't. But like, I just I think for everyone watching, what costs here? I suppose that's the interesting one. For people, they're looking at the system. I think probably a lot of the clients that we have look at want to, obviously they have to have that insurance as they come in, but most of them want to continue that. I think just through peace of mind and the ability to do that, especially the Americans are coming off massive monthly premiums, versus us. I mean, I don't mind kicking off. I'm a family of 4 and we pay, I think, 175 euros a month. I say, I could be wrong. If my wife sees this and shoots me, then you'll know why. But I think it's kind of around there.
Should be right because it should be right because mine just increased last month and I'm paying now 200 euro for me, Sean, and the kids.
It's probably there and thereabouts. So yeah, you're 4 as well. I mean, I use
multi-care.
Multi-care, yeah.
I use advanced care.
Which one, Lilia?
Advanced care.
Advanced care.
Yeah.
Okay. That's not because you're older than us.
Well, on age and older than us, I mean, there are some insurances that won't insure after a certain age.
Yes.
And they are...
It's probably what Nick's got. He hasn't got...
Yeah.
Right,
I know because my cousin, she works in insurance. There's very good insurance here, which is the company's Jan, I think. And they insure people of all ages with all conditions. They have no issues with that. So that's a good one for people over 75 with health issues already. Yeah.
And they're one of the only ones that will cover.
No, and it's not too expensive, like crazy expensive. Okay. No, it's...
Well, that's interesting. I mean, just on that topic, I mean, I think my wife took ours through the bank that were doing something. a lot of people either go to a high street insurance lot or they go to a broker.
Yeah.
And I would probably say a broker is the best because they can give you the broad spectrum coverage, talk you through what happens in each one, and you can then just pick the one you want. They don't cost any money, to you as
And
upfront.
Yeah.
may I also say that one thing I found amazing we work with a rockstar broker. They translate the documents as well, which is super helpful. So they also help you make it easier to understand as a non-Portuguese speaking person, which is also super helpful because it's a lot.
Yeah.
It's a lot when you're moving to a new country and and I think we all want to try our best to learn the language, but it's a lot. And I think jargon and legal documentation. So that's what I found with the broker that was really super helpful as well.
No, I agree. I think there's also people and companies that we've come across that help at a higher level as well. If people have got certain pre-existing conditions that need to be kind of looked at or assessed prior to arriving to see, because let's be real, like the insurance brokers, they don't know about every single condition, in reality. They will have an idea of the mainstream ones or whatever, but everyone's got their own ailment, diagnosed from a different country, etc. So, sometimes it could take a couple of conversations to find out, what and who's the best, and exactly what you need. But just get involved, and find someone that can speak, who can speak the language well. Is always a helpful one to get that point across.
Also, something very important is when you're getting your insurance, see the service providers. As an example, my dentist, I have to go or to Lolé or to Olhão because in Faro, there's only one dentist, and because even with the discount from the insurance, it's still very expensive because it's a very high-end dentist. So it's good to know which service providers you have in the area. And the insurance companies will be able to, there's usually an app or an email or a PDF or something that will tell you all that information.
And I think another one that I was very confused about when I first moved, and please, Lilian, Duarte, correct me if I'm using the wrong terms, but a Plano de Saúde and a Seguro de Saúde.
Completely different. Yes.
Completely different.
Yes.
Plano de Saúde is a discount card.
Exactly.
You can get them. There's a free version with a Continent card that's with Keep Wells. There's a free one, and it just allows you to have discounts with specialists and GPs and family doctors. Like €15 plans, and that's not health insurance.
No,
it's a health plan discount card.
Yeah.
Very useful.
Yes,
but not insurance. And that was confusing for me when I first arrived. I was like, a health plan is not health insurance. So
yeah, I had the same thing. I had that card from the HPA hospital in Lule. And I would just go in there and I'd pay €110 for the year. And then it would drop my GP appointment from 80 quid to 20 or something like that. And I think I even that one time, I had an x-ray and I think that came back in a total of 50 quid for an appointment and an x-ray. And I was like, okay, good. That is pretty good. And actually when I worked it out, okay, if you go once a year, the card's probably not worth it. But if you go a couple of times, then it is worth it. So that that's the quick and easy rather than the full.
You limit it to the hospital Lole, really?
Yeah.
But I mean, this is for, as I say, I was using it as a GP. Instead of going to the Centro de Saúde, I just turn up. Could have been anything. Could have been, I don't know, I couldn't walk. Embarrassingly, I went in and was like, hey, I can't walk. And they were like, yeah, it's because of gout. I was like, oh, thanks. So they were like, right, it's going to give you a massive anti-inflammatory and injection straight into my butt cheek, which was interesting. And then because it was so big, I ended up giving me a stomach ulcer. So that was a nice little triage of circumstances. That came one versus the other, but one after the other. But yeah, I was limited at hospital, but to be honest with you, it's the nearest one for me, really. So you kind of pick your place and you don't go to it.
There's so many different plans there. I think years ago we got one from EDP when we opened an electricity contract for an apartment that we stayed at in the north, EDP said for €5 extra, you get a health plan for the year. And we're like, oh, all right. And it actually worked. We used the KUF private hospitals in the north for my little one. And yeah, same thing, 15, €20 for specialist appointments. And
Yeah, you get the discount. Yeah, definitely.
yeah, there's so many of those things. But
Yeah.
Plano do Sud, Seguro do Sud, not the same thing.
No, not the same. No.
Anything else to add on money and insurances, Duarte, Lilia?
Well, what I usually do is every year I try to go to my broker and try to renegotiate my insurance. I always say to her, can I stay within the same family, so within multi-care? But is there anything better that I can get more in return for the same price, or that I can pay less every month and still get the same that I'm currently getting? And I always try to negotiate. That with any kind of insurance in Portugal, whether it's your home, your car, any kind of insurance, I would always recommend just negotiate every year.
Yeah, I did the same.
Renegotiate in this case.
Yeah, I did the same with my health insurance. I kind of reduced by half with this.
Wow.
Yeah, with the same.
Wow.
I had to change from multi.
Was it after they took the kidney away?
More or less, yeah. I had to change from multi-care to advanced care, but I have the same, all the same covers, but different company and reduced by half. It's a lot. I pay like €75 per month.
Do you remember whether that changed your excess? Like you've got a minimum amount that you have to pay. If you had a surgery, they might say, okay, well, the cost to us is 3,000.
Exactly the same.
But in 300.
I told her I want to keep the same covers, the same excess, everything the same.
Well, wow.
Yeah.
Wow.
Because
That's amazing. So,
Seguros, it's a new insurance company, and they work with advanced care. So they have, more kind of benefits at the moment. It might increase, but at the moment,
Interesting.
yeah, just good
Good.
time,
I think
good offers.
biggest thing I hear from people, especially speaking to clients and having calls, is the difference in price between the US specifically and here. I mean,
Yeah, it's staggering.
and the level of care in the private system, at least, especially for the price, is like you can't compare. It's chalk and cheese.
Yeah.
Well, I mean, look, that touches on a really good point, Claire. There, at the end of the day, it comes down to expectation, right?
Yeah.
And the same expectation as anywhere. Just you can't. Do you pay for what you get? Now, again, coming back to baby, when our kids were born and when we had our room in the private hospital. I mean, we're not talking the Portman in London or the sort of the high end wings of the Chelsea and Westminster. But it was very comfortable. It was clean. The people were lovely, and I couldn't really complain about the size of the the sofa bed thing that I was sleeping on because my wife had just had quite a major surgery. So Princess Me had to sort of deal with that one. But it's in reality, I am. It was a big surgery, and I think it cost me €200 as sort of like an excess, thing. Again, could be slightly wrong there, but it was certainly a few €100 rather than the thousands that it was scheduled to be for the cost of of it. And then you look at the general cost of surgeries here. We talked earlier. I mentioned about a hip operation at 12,000. There was some wider reaching.
My gallbladder and the hernia was 5,000 something. If I had to pay full, I paid €500. That was it.
So I think that's also something, I'm not saying just fly by night, don't worry about her private health and everything else, but definitely get it, if you want that extra cover. But even still, a bit like, not the same, but veterinary care and human care is not priced like it is kind of really anywhere else, in either Europe or globally that I've seen. You couldn't really afford to do it without private health in the UK. Here, $5,000 is a lot of money, but it's not an earth-shattering amount of money for something that's, kind of, very important. So where I think we are generally very lucky here is we haven't got this clean culture, where everything, I mean, from an outsider's perspective, looking at the US, obviously everything runs through, insurance, and therefore it just seems to be they just keep jacking up the prices all the time. Someone's making a shed load of money somewhere, in that whole remit. We don't seem to have that here. So, again, you're probably taking private health. You're not sitting in a, gourmet wing and, of Gambelish or wherever, getting premier treatment. It's like a hotel, but it's good, it's clean, it's prompt. From my experiences of that, I've never had that issue. So I suppose trying to probably, kind of move towards wrapping this up. Just if you were just to, choose one or the other, money is not an issue, public or private.
Do we have to choose one or the other?
Yeah.
Either or. Okay.
So,
Public.
this is not okay. We're disregarding the emergency moments where, you don't get to choose. But like, are you investing or are you not?
I'm going to be honest. The reality is, if you have a cancer, if you have a heart problem, if you have something truly severe, the best ones is the public. So you kind of want to choose the public.
Yeah.
But it's the small things that the public fails. It's when you have the flu. It's when you just have a broken finger, or when you have a sprain, or this is where they fail, because it takes a long time, because there's 10,000 other people with a sprain. There's 10,000 other people with a skin problem. There's other, and that's the situation. It's the reality. Because in reality, my father is a perfect example of someone that had a melanoma, and it was done in IPO in Lisbon. Cost us absolutely nothing. Didn't literally cost us nothing other than traveling back and forward to Lisbon. It was a fantastic service. He was seen. He had these surgeries. He had his chemotherapies. He had a radiotherapy. He had what's the name? Immunotherapy, free, and it was fantastic. It gave him 3 more years to stay with us when he was supposed to live only 1, So public system does the job, but again, only when you get to that stage that you kind of like.
But how come interestingly on that, how come he went to Lisbon? Because that's where they offered it, or he thought they'd get a better service up there?
Because for his type of cancer, it had to be in Lisbon. They didn't have it here.
We don't have.
Well, look, that's even very interesting in itself. Like, are you having to go to different places if you get a certain type of cancer that actually, even though you're based in the Algarve, it doesn't matter if it's public, you're going to get told to go to a hospital in the north.
Yeah.
Yes. My dad's case was exactly that. He couldn't do it here, other than a few treatments and exams. But other than that, every time we needed something, we had to go to IPO. And also, there's something called the Champalimau Foundation, and again, it's for free. My father went there and did a few treatments because you can volunteer for experimental treatment. So if you're in a situation that there's nothing else that they can do, you can go to foundations like Champalimau Foundation and say, "Hey, I'm pretty much done. Try whatever you want on me to see if it takes me somewhere." And they're good.
And did you say IPO as a hospital?
IPO, yeah.
Okay.
It's a hospital that only treats cancer in Lisbon.
And then I suppose, just sort of, maybe a slightly inflammatory question is, where should Portugal invest? I mean, I know you can't halt private money, but if there was money being put in, public or private.
Well, at the moment, actually,
and frame Algarve.
The Algarve is going to have a new central hospital. This has been decided, and apparently it's going to go through.
Although
not sure where.
It's been delayed for I think 4 years.
Is it? Well, then
there was something in the news yesterday about it.
Oh well.
But it's one day.
It's one day.
It's coming. Yeah. I would say public. Invest in the public, and I would say. I mean, this is another webinar for another day, I'm sure. Or, a roundtable with some wine and beers. But I think incentivize doctors to come back to the public system.
Yeah. Definitely.
Salaries are a huge thing. Cost of living in the Algarve, housing prices, housing crisis, and the pay is low. They are getting more money in the private system. If you incentivize the doctors to come back by paying more, or other incentives. Faro Hospital just completed their first robotic surgery. Portimon's has done 50 of them. So that's cutting edge technology that is attracting surgeons from other parts of the country and attracting surgeons to the public hospitals who are now getting this cutting edge technology. So there is that sort of investment. But then I also read an article last night only that INEM is no longer providing ambulances in the Algarve next year. It will be down solely to the Bombeiros and
Yeah.
private institutions. So there will no longer be those lovely INEM ambulances. There is also only currently one helicopter operational for emergency airlifts. And some of the journeys have to be 4 hours plus. So if I were to say if Portugal should invest, I think there's enough private investment going into the private sector. The more the merrier. I think we need more private infrastructure, but I would say public.
Yeah.
Agreed.
It's a bit of a mix, because here in Portugal also there's a bit of the doctors have their own kind of I don't want to use the wrong term, but they have their own ways of doing things. As an example, a doctor here in Portugal, he doesn't actually choose what type of medicine he's going to practice. What happens is he can apply for several types, and depending on his grades, he might get it or not.
Yeah.
So you might get a doctor that wanted to be a general surgeon, he wanted to just be a surgeon, or he wanted to be a pediatrician. He ended up being a skin doctor, because that was his fourth choice on the list. So you don't actually choose what medicine you practice. You choose whatever kind of it's available when it gets to you in your grades that you had when you were studying, which is, I don't believe it's fair. Also, another thing is they work way more hours than they should. The same thing with I don't get worried so much about the doctor's pays, because I've never seen a poor doctor, but I get worried about the people that are actually most of the time with you, which are the nurses. Those get poorly paid for what they do and the amount of hours that they work. But our doctors, they work long, double, triple shifts, like it's beyond ridiculous, and nothing is done about that. And of course, the investment. There needs more hospitals. There should be more clinics. There should be more doctors, more nurses, more facilities, more, everything. And you could see that example when you talk about pregnancy. The reason why we didn't have our daughter in the public was very simple, because basically when you go to the public hospital, my wife with our first son, she shared the bedroom with another 3 mothers, which there was only one curtain between the 4 beds, because the other ones I have no idea what they were. Her blanket, it looked like a cardboard that you're opening, dry as hell. I had to go home and get her a proper pillow and a proper blanket for her to sleep in. The food is horrible. I had literally a wooden chair to sit next to my wife, and because it's kind of a meat process factory, like do it next. And I get it, they don't have the money, they don't have the facilities, the staff and everything, but they should, health and education for me should be always number one option, period.
Yeah.
If you educate well people, if you have good healthcare, then hopefully the population grows to be nice people that care for others, and so on and so on.
Yeah.
So
Okay, well, look, I suppose in summary, I think from kind of what we've been saying, that lean on the private sector. So get health insurance, I think, is probably the thing that the 4 of us are sort of putting out there. Why? Because it makes those quick, easier, smaller appointments, the broken arms, the nick snivels, the whatever it may be, it's easy, quick, and you're not burdening the system. And if you've got the luxury of being able to pay, for that kind of premium, and then the excess when you're there, then it just means you're not a drain on the system, and the burden and the money could be spent elsewhere. But in reality, big problems, big health issues are probably going to be dealt with at a higher level anyway. regardless of whether you've got it. If you've got it, perhaps it still covers you if you've got the right care. So, just be accepting of the fact that you are going to lean on that. Obviously, the system is here if you can't afford it, and once you've gone past your year, you're able to use it as a Portuguese citizen, resident, sorry. But ultimately, it comes down to you as a person and the preference, and your assessment and your health condition at the time of when and if you move here, to really make that sort of choice for yourself, whether that's geographical living because of the lack of ambulances, perhaps. You just have to make that assessment yourself when you're considering where you kind of want to be. So, yeah, I mean, we would love to hear. I mean, I'm sure it's quite an inflammatory topic, and we'd love to hear in your comments on your own experiences, whether you're here already, whether you've got questions because you want to move here. We are obviously of an age profile. I'm not going to ask everyone to give you their ages, but we're a certain age profile, and I suppose and lifestyle. So we probably haven't answered all the questions that may be prevalent to you, but if we can't, we might have someone, or there might be other members of our community that could talk about their healthcare stuff. And if it means that we do another roundtable and bring more people in and get going, then happy to do it, or a live webinar on that topic. And we bring people in who can chuck it in. Equally, we will be doing some stuff on insurance. But if you do in the meantime want to get in touch about talking to an insurance broker about the different packages and what it might mean for you in your cost consideration of moving here, then great. So yeah, well, look, thank you for putting up with us before. I think it was best part of an hour. It's great to learn more things about pipes and kidneys that I didn't know before. And I'm definitely
history.
Definitely worried about getting in your car and seeing that poking out somewhere. But yeah, look, thank you for your time for watching this. I know it's not your normal episode with Nick sitting on the beach somewhere enjoying himself, which we all think is disgraceful, but we have to allow him a little bit of bandwidth every now and again. But I hope to not have taken up too much of your time. I hope it was helpful, and enjoy the rest of your Sunday. Thanks, guys.
Bye, Nick.
Bye.
Bye, guys.
Bye.